a note to do a surgery and to import the biopsy site from a previous biopsy appointment.
So here we already have our mannequin for the patient. We want to go back to a previous problem. So we're going to hit the time clock review, and we're going to go to the location of the previous biopsy that we now need to excise. So I can see here that we do have one for the forehead, and we're going to grab it to have the exact location name. We're going to go ahead and click accept and put it as undefined because we still have not done the procedure. We're going to close, and now when we go to that one, we have the exact location there. It's not going to change the name. It's going to keep it exactly the same, and that's what we need to have the consistency for our biopsy and pathology to match the same name. Now we have the area, but we need to add the procedure, which is going to be the excision and the repair. So you already have the location, so instead of creating a new one, you're just going to go under the red to create a treatment plan. Now I'm going to go ahead and put surgery, or you can also put excision, and we are going to be excising a dysplastic nevus. So we're going to go ahead and click on that, and it automatically attaches to the location. Now we also want to add our repair, which is the closure. So you're going to go under the red, and you're going to put repair, and it's the complex. Now you see that they are in here. However, they're not connected to your mannequin yet. You have to attach that yourself. So you're going to click on that location, and you're going to go under the scalpel without the plus sign, just the regular scalpel. And you're going to click add new procedure. Here you can see your excision and your repair. You're going to add your excision first. You're going to add another procedure and have your repair. Now you can see both of them are there, and that's how you add them.
Changing their sides.
You would go ahead and click close.
And then to put them sizes.
So in order to work on the note, you're going to go ahead and click on this, and we're going to go right back to your scalpel. And this we need to go ahead and adjust for sizing and all the extra documentation that we need for the note. So we're going to click on the excision, which is the beginning one. Right here you can see the location and the status, which is going to be performed because we're going to be doing the excision. Now here you're going to need initial dimensions. These dimensions are the initial dimension from the biopsy site. So here you can go to diameter, and let's say that the biopsy originally was 0.2. You're going to go ahead and move it to 0.2 and press done. Now you want to make sure that you're taking pictures of the site after Dr. Kormeili has marked it, and afterwards as well. The one you're going to add here is going to be the pre-op image, which you will click on the green to take photo, and you would take a photo of the excision. So you go like this, make sure it's clear, press it, and you're going to click to use photo. You're going to wait for it to upload, and you're going to press done. Now you can always have it there. You need to have it attached to your note in order to have the picture connected to the location, which is very important. Here we're going to go ahead and go to the bottom, which here we need to keep track of how much lidocaine with epi Dr. Kormeili has injected onto the patient to numb them. So here we would go ahead and click on it, and to change the quantity we would click on the area, and here you can see that the volume, we can adjust it. So let's say she did 2 mLs and she did lidocaine with epi. If a patient is allergic or cannot be numbed with lidocaine with epi, we can always look up with whatever the doctor will be injecting with, and if we don't numb, then we can always erase as well. We're gonna press done. Here There's no complications. The hemostatus, you want to make sure you change it to mono. So we don't do this one. So I'm going to remove it. We do electrocautery monocular. And we're going to press done. These little details are very important because we need to have the accurate procedure logged into the patient's note. Here, you always want to make sure that the instructions for pathologists have check margins. We need to make sure that all the margins come back clear. For the surgical scrub, we only use Hibiclens, so we're going to remove this one. Press done. Now the one last thing, it is going to be the post-op dimensions that you're going to go ahead and need here. So this one will be the dimensions after doctor has excised the mole. So we would go ahead and measure that, and we would put the correct measurements there. And if this is very important for you to always log into your note, we need the initial, the post-op, and the final length. So now I'm going to go ahead and go to the repair process. I'm going to hit close, and I'm going to put repair complex. Here, you would see that the initial dimensions get automatically transferred, so you don't need to adjust that. But what you're going to need is your post-op image. This one right here is going to be the final image with the sutures already on the patient. You would do the same thing. Take a photo, make sure you click here, and you would go to your closure with your sutures. Take the photo, use photo, and press done. Again, you always want to have them attached to your location. After that, sometimes Dr. Kormeili will inject more anesthesia if needed to the patient. If she doesn't, you also need to adjust. So in this case, she did not inject any more. So I'm going to be putting 0. There you go. There's no exposure of the bone, so we always want to remove that. The way you do it is you click here, you remove bone, go back, press done. Now, it's very important that you know what sutures Dr. Kormeili is using for the closure, and you can also adjust it. So the way you do it is suture sizes. So let's say instead of a 4-0, she's using a 5-0. And here you can change from polysorb to any other material. So let's do this one. And we can use the suture technique. We can always change it here. Once you made your adjustments, you press done. Done. It gets fixed, and then you would do your epidermal. So deep, it's the ones that she does first. Those dissolve on their own. The epidermal is the one that you're going to see on your picture. So here again, we can make adjustments if needed. So we can move to a 5-0, and then we can change if we need to change the material or the technique. We can always change it. Make sure this is accurate. At the end, you're going to go ahead and do your post-op dimensions. So that is the final length after the sutures. So let's say it's 3.4. And you're going to go ahead and press close. You always can double check that all your measurements, quantities are correct here. And after that, you just press close. And we want to make sure we print the sticker that's going to go into the specimen bottle. What we do is we click on this little arrow. All the icons are going to show, and we're going to go to the printer. Here we're printing a procedure, not a location. So we're going to go to procedures, click on this plastic nevus excision, press done, and we need to print it into a sticker. So we're going to change to the printer brother, and we're going to go ahead and print it. Sorry. to our patient. So we're gonna go to print it again, procedures, done, brother print.